So, why do so many women get fibroids or endometriosis, and why is it often misunderstood as something else?
Uh, well, the reason actually is not very well known why so many women get fibroids and endometriosis. Now, all of us have the uterus, all of us have the estrogen hormone, so it is a combination of the reaction between the two which causes the fibroid and the endometriosis. But some women develop, some don't develop. There is a lot to do with anything in our body. At the end of the day, any disease we develop or any symptom that we develop is very much related to our genetic makeup. So I think we do inherit certain amount of genetic makeup from our parents and ancestors. Added to that is the epigenetics, which is where our lifestyle, which has changed to a large extent as compared to women in the olden days. For example, to start off with, one of the things that has changed is before they probably would get pregnant at the age of, say, 19, 20. I wouldn't say that was the right thing to do, but yes, they would get pregnant at the age of 19, 20. Then they would have about 4 or 5 children. So they would have one child, they would be breastfeeding, and then by the time 2 years down the line, they would have another child. So large portion of the reproductive period was actually not overloaded with estrogenic influence. There would be a lot of progesterone and lot of time period where they wouldn't have a period, which in itself is one of the protective factors for endometriosis, especially, and to some extent for the fibroid as well, because these two conditions, one common thing in both of them is that they are estrogen dependent. So the more estrogen you have, the more chances that it's not that you would develop, but if you have the tendency, you would make more fibroids and more endometriosis. At the same time, there used to be obesity was a uncommon thing earlier because every work was done by the woman at home, from washing clothes and carrying water, and so the gym was not really, it was an inbuilt
Right.
part of the life. Now you have got to be motivated to get to the gym, and with the lifestyle that we have, sometimes it's difficult, and the amount of cuisines that is available all over the world, and the amount of food delivery apps that you have, everything is kind of almost pushing you towards obesity. And the fat underneath the skin also produces estrogen, and which can affect of endometriosis and fibroids. So it is becoming more common, I would say, because of these reasons. Plus, all the additives in the food and whatnot is going into the hormone added chicken and whatever, all those. And also, one of the reasons is that the modalities to pick up these conditions have increased. So there was no ultrasound, so people wouldn't pick up fibroids that easily. The attitude towards problems that women have has changed. Before, it was expected women to have pain during the period and just get on with life. It was not that she has pain, she's suffering from pain, let's go investigate, do something about it. Now that, I would say, the families and men have become more considerate towards the sensibilities of women, and women have become more aware that if they have a problem, they need to actually seek help. So the diagnosis also has increased. So that's where we see commonly fibroids and endometriosis.